Hi there, this is Lori Edge-Hughes, and this is your 4-Leg Rehab Minute. And today's minute, I want to tell you a little bit of a story and then a rationale for treatment. For what I think could be chemotherapy-induced central nervous system impacts and the vagus nerve involvement. Okay, so I have a dog that's undergoing chemotherapy for, I think it's rectal cancer. Anywho, he's been doing okay. Owner is extremely diligent and they have insurance, so expense is not a concern. They're doing everything. Dog was doing well. Come to chemo appointment. I don't remember if it's 3 or 4. I think 4. And the dog comes back in and he is ataxic. He dribbles urine. She's been told this doesn't happen with this drug. He was good up until then. And basically kind of like, we don't know what this is. Dog was looked at and evaluated and they can't find a reason. So she brings it to us. We've seen this client, this dog regularly for years. We know this dog very well. So anyways, comes to us and I'm like, okay, well, we will look at everything as well. Check the neck, check the thoracic spine, lumbar spine, lumbosacral junction, sacroiliac joints, anything that should make sense to add up to why this dog is ataxic. Can't find anything. So I'm like, my gut feeling says this is central. This is central nervous system. I don't know, but I'm gonna, you know what, you're here. Let's try treating the vagus nerve. So, pardon me. I didn't know how this was gonna go, but she just emailed me this morning, last night. I don't know. I read the email this morning. And she's like, oh my gosh, he has been so good for the last, all the days since I saw him. So I think I saw him last Thursday. She says, like Friday, Saturday, Sunday. She must have emailed me yesterday. He's been fantastic. So I decided to go onto PubMed. I decided to use my AI and figure out what could this be about, how, what. Alrighty, so let's boil down. First on, chemotherapy agents, and then there's some that are very specific in veterinary oncology, okay? So vincristine, platinum compounds, doxorubicin, cytarabine, whatever, they mean nothing to me. But drugs, some of the chemotherapy drugs can cause neurotoxicity through direct neuronal glial damage, oxidative stress, mitochondria dysfunction, inflammation, which causes a cytokine release, and disruption of axonal transport or the blood-brain barrier. Alrighty, effects can be cumulative, with subclinical damage in early cycles that progresses to clinical signs like ataxia, proprioceptive deficits, paresis, lethargy, or behavioral changes by later sessions. And in dogs, the vincristine toxicity can be amplified in dogs with the MDR1 mutant variant or breeds in there, right? The white feet don't treat, that you don't give them ivermectin. That can also have an impact with that particular drug. Due to enhanced central nervous system penetration. Okay, central effects may involve hippocampal and cerebellar inflammation, while autonomic involvement can include vagal pathways, and that can contribute to dysautonomia. Okay, so with this particular dog, I was like, I don't know, let's treat the vagus nerve. This is the only thing I can think of where I can impact that central nervous system somehow. It was a shot in the dark. Okay, here we go. So the vagus nerve, cranial nerve 10, is the main parasympathetic outflow, is vulnerable to chemotherapy-induced damage. Agents can impair autonomic fibers via microtubule disruption, oxidative stress, neuroinflammation, leading to reduced vagal tone, sympathetic dominance, and autonomic dysfunction. So it could potentially alter heart rate variability, gastrointestinal ileus, or pain modulating deficits. And this exacerbates central nervous system signs by promoting systemic and central inflammation, worsening neuronal recovery, and contributing to cumulative ataxia or weakness through disrupted autonomic neuromuscular coordination. Okay, so why and how the vagus nerve stimulation helps to remediate the central nervous system. Okay, so non-invasive vagal nerve stimulation via acupuncture, laser therapy, and manual techniques, which is what I did, okay, activates the cholinergic anti-inflammatory pathways. Vagal efferents inhibit pro-inflammatory cytokines in the spleen and the central nervous system, reducing neuroinflammation central to chemotherapy-induced peripheral and central neurotoxicity. Let's talk a little bit about the spleen. I am that kind of nerd that likes to read nerdy books. So can you see this one? The Great Nerve by Kevin J. Tracy, MD. Okay, just finished listening to this book. Loved it because I'm a nerd. But in part, this is somebody who has researched the vagus nerve his entire career and talks about all the different findings that they had, one of which was ultrasound to stimulate the spleen in order to stimulate the vagus nerve, and they found that it had an impact in decreasing inflammation as measured by a decline in tumor necrosis factor, which is cool. So when I'm trying to stimulate vagus nerve now, I'm using lasering the spleen. They also did some on the liver, so I do that too. Okay, so that's a little bit of a woohoo, got excited there. Alrighty, so blah, 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 blah. Mechanisms of benefit. Anti-inflammatory and neuroprotective. It can suppress glial activation and oxidative stress in brain regions like the hippocampus, cerebellum, which can help with coordination and reduce ataxia. Autonomic rebalancing. So it can restore parasympathetic tone, improve heart rate variability, and countering sympathetic overdrive from the chemo. There may be technique-specific effects. So acupuncture can stimulate vagal afferents, so the ear points, okay, neck points, and modulating the brainstem nuclei. Okay, so go to my talk on vagus nerve. Go to my 4-leg rehab education in the training videos, vagus nerve, and I also have one on GULP, geriatric onset laryngeal paralysis and polyneuropathy, because I got some stuff in there about vagus nerve and the stuff I use and the acupuncture points I use. Laser, so photobiomodulation, can enhance mitochondrial function, reduces local inflammation, and influences autonomic pathways, effective in just neuropathy models. Okay, so I'm lasering the brain stem in through here. I can laser the neck, vagus nerve, where it comes down, and my new pastime is lasering spleen and liver. Okay, throw that in your nifty box. And then lastly is manual therapy. So providing gentle cervical, so neck massage of sternomastoideus, okay, sternophalicus, any kind of neck mobilizations, C1, C2 mobilizations, and my myofascial techniques at the occiput, suboccipital region, that sort of stuff. I incorporate that, okay, and auricular ear, basically going in like the hard stuff in your ear in through there, cleaning the dog's ear. Stick a Kleenex on your finger. Go ahead, clean the dog's ear. Teach the owner to do the same. Alrighty. So these were a bunch of the things then that I had also given the owner to do, to massage in through here, massage the back of the head. Here's the acupuncture points to stimulate in through there. Yeah, that's about it. And some different things that she could do. Okay. And so basically in dogs, these approaches can leverage established rehab principles and align with vagus nerve stimulation that is used in canine epilepsy. So that works in that compartment. I'm just suggesting it for a different avenue. Okay. And so the stuff that we can do from our rehab toolkit can offer a low risk integrative way to support recovery from cumulative neurotoxicity without drug interactions. Okay. And clinical success, as in me, I've had clinical success and I'm a little bit excited. So I hope this lasts. I haven't heard how long it's lasted, but as of today, it's lasted a few days. Okay. Likely stems because we have dampened down inflammation, enhanced neural repair, and that can help improve gait coordination, overall function. So anyways, oh my gosh, this is like a 12-minute blah, 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 blah. But I was so excited to read this gal's email and go, oh my word, did I just hit something? I don't know. Give it a try. See what you think. Until next time, cheers.